Hello and welcome to today's webinar, Progressive Synchronization, Training Before and After Hip or Knee Replacement. My name is Mike Diebler, and as always, thank you for choosing Exercise Etc. for your continuing educational needs. I'm excited to go through this topic with you over the next couple of hours. A lot of information we're going to be going over. Throughout this webinar, we're going to really stress the importance of understanding working with a client with joint replacement, looking at some numbers and statistics. We want to make sure we review a few of the different procedures just so we have an idea of what's going on in these joint replacements. And then really what I want to spend the bulk of the time is making sure we have a good step-by-step progression and plan in place that we can take our clients through, whether they're going through a hip or knee replacement surgery or preparing for those surgeries, so we can best help them be as successful as possible, with the ultimate goal is getting them back to whatever they were doing before, and in many cases even more than they were doing before, because there's a good chance they were in a lot of pain and their activity levels have decreased. So this might be a great option for them to get back to some of the things that they love to do. Before we get into it, just want to take a second and introduce myself. Like I said, my name is Mike Diebler. My background, I have a master's degree in sport and exercise science from the University of Florida. I was a former All-American athlete in college where I got my bachelor's degree in kinesiology. And now I am out in San Diego. I'm the owner of a personal training studio called San Diego Premier Training, located in Carlsbad, California. We see a wide range of different clientele, many clients who have had joint replacements, preparing for joint replacements, plus a wide variety of other clients, both older and younger. On top of training and running the business, I am the director of education at Exercise Etc. So I do get the opportunity to put a lot of the course content together that you may have taken previously. I'm also an adjunct faculty at Miramar College, so I teach a few different courses there, primarily exercise physiology. So you can see I do love the teaching aspect of the fitness industry. I love being in the action in the trenches and working with clients, and I love researching and educating others as well. So I think it's a great combination and a great industry to be doing this. And I'm also a consultant and a subject matter expert for other organizations out there. All right, well, you're here today not only to learn some great information, but also to get your credits through your certifying body. So you can see here we have a number of different partners that we work with, so you can get your credits. So if you're certified through a number of different ones, you'll hopefully be able to satisfy a few different hours for these different certifications. Now, just real quick, in order to get your certificate for this webinar, step one is you do have to view the complete webinar. So once we go through, it'll be approximately 2 hours in length. Once you finish viewing it, you're going to log on to our website at exerciseetc.com. Click on the administration tab at the top of the screen, and then you're going to click on Webinar on Demand Certificates. And then just make sure you choose the correct title that you see highlighted here. We have a few other courses and sometimes the names are similar. So I want to make sure that you are getting the credit for the right course. And as you can see, there is going to be a quiz with this webinar. We have a 20-question quiz that you're going to be required to go through. So make sure you do select the appropriate title. And if you're not sure, you can also view your receipt in order to see which course you took. So you'll select it, you'll enter your email that you used to order the webinar, so just make sure you are using the same email address there. You are going to complete that short 20-question quiz. There will be a brief evaluation, so you're going to let us know how you like the program, and then you're going to fill out any other required fields and click Get Certificate, and then your certificate's going to be emailed to you instantly. Don't forget, if you don't see it right away, just check your junk or your spam folder and make sure that it didn't end up in there, and then you'll be able to download it or print it or whatever you need to do. Okay, as I mentioned, there is a quiz, and sometimes that gets people a little bit nervous. We tried to make this as easy as possible for you. So you do receive a handout with this webinar. So just make sure you have that with you. The questions are going to sequentially follow that outline, not necessarily the lecture that you're listening to right now. So just make sure you have the handout with you, and you're going to be all set for that quiz. And then one final reminder, just want to remember to complete this webinar and print their certificate by December 31st of the same year in which you ordered it. We want to make sure that you do get credit for watching this webinar and taking that quiz. So if you have a certificate with next year's date, it may not be accepted. So just make sure that you do take care of that by December 21st or 31st in the same year in which you've ordered it. Okay, now that we went through everything you need to know to get your certificates and your continuing ed, let's get into the course content. So there's a good chance you're probably already working with somebody who has gone through a joint replacement, potentially multiple joint replacements. If you have not, you are most likely going to be seeing somebody at some point in your life, or maybe this is something that potentially you might be going through. So this is all good information that all fitness professionals just have a good understanding of, so they're ready to work with these types of clients. So we can see that the joint replacement surgeries are becoming more and more popular, and for many, a great solution to help fight joint degeneration. So we have almost two ends of the spectrum that are facing this position here, where we have many older adults who are staying more and more active. They were active when they were younger, and they want to continue to be active. And we know that the joints only can take so much, and there's going to be some breakdown and arthritis and other issues that we'll talk about. And it might be to the point where that joint has to be replaced. And sometimes we have those that are just not moving at all, and that has its cost on the joints. Maybe very sedentary, very tight, overweight. All of these things are going to contribute as well. So whatever the reason, we are seeing a growing number of individuals going through both hip and knee replacements. So we can see here some numbers. In 2010, 7 million Americans lived with a hip or knee replacement, and by 2030 it's estimated to reach 11 million. So why do people find themselves in this position? So I've already talked about a few, but the biggest reason that we will end up here is arthritis, whether that's osteoarthritis, which is the #1 reason we would have a joint replacement, but also rheumatoid arthritis is going to be in there as well. Now, why is there arthritis going on? That's a whole nother discussion that we can talk about, but for some reason that joint is starting to become inflamed and degrade, and it can no longer support the activities and the movement that that individual is doing and needs to be replaced. We also see trauma and falls, so accidents, falls, things like that can potentially lead, whether it's an immediate issue, car accident, and maybe a joint has to be replaced, or maybe there was a fall and then over time more and more wear and tear just got to the point where the joint could no longer support that activity and needed to be replaced. Another big one, and really, these are kind of cyclical, they lead to each other: overuse, repetitive stress injuries. So often these overuse and just repetitive movement over and over will lead to arthritis, and kind of puts us right back at the top again there. So kind of looking at the cause of some of those problems. So this could be from exercise, right? So I might have somebody who's just a lifelong runner, and they've been running their entire life, and that's a lot of wear and tear on the joint, and a lot of similar muscles, similar joint actions happening hundreds and thousands and really thousands of times every time they go and run. So that just is leading to that degradation of the joint. There could be things like bone tumors and other diseases, necrosis, where there's basically the inability to form new bone tissue. All of these things can also contribute to joint replacements. And then obesity is a big one, right? So the more load that we're putting on the joint, the more likely it is to break down. So just to kind of keep it general at first, so we are going to look at both hip and knee, but really just in general when we're talking about joint replacements and some of these injuries that we might be dealing with, we just want to focus on a few goals. And #1 is just identifying certain risk factors. And we are going to discuss what those risk factors are. But we just want to make sure we understand what risk factors are modifiable, meaning that we can change, right? Something like activity level. So somebody who is inactive, it's going to be a risk factor for negative things to happen, right? So we want to make sure that's something we can modify. We can get somebody moving better and just moving more often, and that's going to help improve their chances of success after a joint replacement surgery. There are going to be some things that we may not be able to modify. Age, for example, is going to be a risk factor, and obviously we don't have control over something like that. So we at least want to understand what are all the risk factors that might decrease somebody's likelihood of returning to activity after a joint replacement and being functional again. And what do we have control over? Or what should we at least just be mindful of if we don't have control over it? One of those modifiable risk factors that I stress it, so I bring it up here as well, it's managing asymmetries. So just think, for many individuals, now I know some people will have bilateral replacements, both sides are equally bad, but we have many who they have one side in a much better position than the other. And most people, the first thing they do is not to get a joint replaced, right? So maybe they do therapy, maybe they do nothing, they ice, and they just try and avoid using it as much as they can. They're going to start to develop some serious asymmetries. This can be things like mobility, right? So we might see a lack of mobility on one side compared to the other, and this can be strength and stability, right? So they just don't have the same strength left to right. Now we know you're not going to be perfect, not perfectly symmetrical. We will have one side that's going to be stronger than the other. We just want to keep these within reason, right? We don't, the bigger that gap is from your left and right side, the more likely that something potentially that this can be a problem. So that is going to be important that we understand these asymmetries. And that's kind of goes right into our next point. In general, we want to make sure we're improving mobility, improving strength. And this, will be the lower body, obviously, but the upper body, everything is connected. I want to make sure that both left and right sides are equally mobile and they are equally strong, and making sure that we are looking specifically at those things. Then we want to look at balance. Fall risk is going to be a big concern for many of our clients that are going through joint replacements. So we want to make sure we understand all the things we can work on with balance. And we do entire balance courses, so we're just going to touch on it here, but we want to make sure we are looking at improving static and dynamic balance to prepare them for whatever activities they're going to be doing. We want them confident and comfortable to go out and do whatever they love doing. We want to make sure we understand proper progression, right? So when we first see a client, maybe it's they're right out of therapy, and what are we going to do with that person? And where is the ultimate goal? Where do we want to take them, right? So we have our starting point, we have where our client is today, and then where do they want to be in 6 months, right? Now our job is to develop a plan that is going to get them to that point, and understanding what is the appropriate progression to take them through. So in this course, I tried to outline it as in a simple way that we can progress going through different phases based on how they're doing after their surgery. And then we want to make sure we're always reevaluating, right? We're going to measure some baselines and just see, are the things that we're doing helping our clients? Are they getting more mobile? If we saw that there was significant restrictions in their mobility, and I start doing some mobility exercises, is it getting better, right? I want to make sure I am monitoring all of these things to make sure we're on the right path. Not everything is going to be overnight, but we should see improvements, and they should feel like they are seeing those progressions there. So it's always nice when you have numbers where we can see, yes, we're definitely seeing some improvements in whatever we're working on there. Okay, so I talked about those risk factors. So there's a few areas of research that look specifically at this, looking specifically at their pre-op condition and how that will influence their post-op success, right? So if I take somebody before they go into surgery and we have a little bit of information about them, how likely are they going to be successful from this surgery? So here are some of the most common risk factors that we see. And as you can see, like I mentioned, some of these are modifiable and some of these are not. So we just need to understand that. But even if we cannot modify it, we want to know who of our clients may potentially be at higher risk, who might we have to pay a little bit more attention to, or talk about specific things that might help them in any way possible. So looking at depression and anxiety, this may sound unrelated, and this might be something out of our scope of practice, right? We're not qualified to deal with depression, potentially help with anxiety, but this is at least something to be aware of that might be important with our clients. So looking at one study, a diagnosis of depression led to a 21% increase in 90-day readmission for knee replacement, meaning within 90 days, they had to be readmitted for some complication. 21% increase for knee, and they actually saw an even higher in hip, 24% increase in those suffering from depression and hip replacement. So we see there a very strong link between depression and complications, things like anemia, infection, pulmonary embolism. So the connection is not crystal clear why this is, but we just see that there is this correlation between those that are suffering from depression and those that suffer from higher complications post-surgery. So just, again, something to be aware of and help educate our clients if that is a concern at all. Liver disease is another one. So again, something we may not have direct control over, but our clients should be aware of, and hopefully their doctors are letting them know. Those that suffer liver diseases, things like hepatitis C or cirrhosis, are at a much higher risk of complications. Again, things like infections, hematoma, dislocations, longer stays in the hospital as well, so greater healthcare costs there. So all things to be aware of. Malnutrition. So it's kind of interesting if we look at number 3 and number 5. So we see malnutrition and obesity, so it's overnutrition. So both leading to complications, right? So we see that low albumin levels. That's typically what they're looking at when they'll diagnose malnutrition. So when we see those with lower albumin levels, they are going to have a greater risk at complications as well. One study showed that there was a 28.6 rate or increase of unplanned ICU admissions. So this is post-surgery. Those that were malnourished had higher chances of a visit to the ICU. So obviously something that we want to avoid. So we want to make sure that we are looking at the quality of their nutrition. So they are getting enough calories to start, but also that they are getting the micronutrients that they need to help their body function, right? Surgery is a very high stress to the system. There's a lot of things going on there, and we want to make sure the body is best prepared for that surgery, and then even more importantly, to recover from that surgery. So we're getting all the nutrients we need to support that. So we're going to focus obviously on the exercise throughout this webinar, but this is just an important concept to bring up, that they are at least aware that what you eat pre and post surgery is going to be really important for that recovery from the surgery. So making sure specific, obviously we want to focus on a variety of nutrition and macro and micronutrients. Vitamin D, which seems to always be popping up, but that's one specifically that we've seen with lower vitamin D levels leading to higher complications post-surgery. Older ages, obviously as we're getting older and older, it's going to be harder and harder for us to recover from high stress situations like a surgery. So just, again, being aware that we are understanding what age group our client is in and the appropriate precautions that we have to take. Obesity, like I mentioned, the more body mass we're carrying around, the more stress on the joints, the harder it is to recover. There's probably a lot of chronic inflammation that's not helping with the situation. So there's a few things with obesity, metabolic disease related to obesity, diabetes. All of these things are going to reduce increase the likelihood of complications post-surgery, and we just want to be aware of this. Now, as I bring all of these up, it doesn't mean that just because you are obese or you are older or you are depressed that you are going to have complications. It just means you are at a risk factor, right? It's increasing the chance that something could potentially happen. So we always want to stack the deck in our client's favor. So making sure they're aware of these things and doing the best they can, both pre and post surgery, to help out. And then our last one, which is, probably the easiest one for us to modify, it's that lack of strength and conditioning, that lack of fitness pre-op. There's a lot of research showing that the condition you are in before surgery, that's influence in post-surgery. So the more fit you are, the stronger you are, the more mobile you are, the faster you will see that recovery. And this is a really important thing when we see the growing healthcare costs associated with all medical care. Anything that we can do to help ease that cost to the healthcare system is going to be massively appreciated, right? So getting them in better shape, almost like training them for the surgery. So these simple things that we can do to help increase the likelihood that they're going to succeed post-surgery. So on that topic, keep in mind, training before surgery has a dramatic effect on improving recovery. Things like shorter hospital stay, like I mentioned, lowering that healthcare costs, faster improvements in range of motion, reduce pain. Reduce pain during before the surgery, reducing pain post, meaning they potentially are taking less medication to deal with that pain. All of these things are going to be very important when dealing with these joint replacement surgeries. So the main thing is we want to make sure we focus on strength and cardiorespiratory exercises that are manageable, that are some things that they can do, right? We know the joint's going to be replaced, but we don't want to go in with the attitude that we can do it whatever we want because it's going to get replaced. Because as they're moving, if it's really painful, they're going to start changing the way they move, and we don't want to modify their movement patterns because those aren't so easy to get back. So we want to make sure we're sticking to exercises that they can comfortably do. So water aerobics might be a great way to get them to move. Some maybe upper body strength training, single leg. On the non-surgical side, there's lots of different things we can do. And really keep in mind, everything that we're going to talk about in today's webinar, these are all going to be great exercises that we can do with our clients, whether we're kind of talking about it more post surgery, but really you can take, especially in our phase 1 exercises, definitely can do these exercises pre-op as well. So just keep that in mind. If you have the opportunity to work with somebody before going into the surgery, you have a lot of impact that you can help them with. I know obviously sometimes that's just not the case. You don't know about them until after they've had the surgery. But anytime you have that opportunity and work with a client pre-surgery, all these are going to be great exercises for you to implement with them.
Okay, here we just see some numbers that really reflect that there is a lot of success with joint replacement. And now here we're looking specifically at the hip, but you'll find that the numbers surrounding the knee are going to be very similar. So the success rate 10 years after surgery is 90 to 95%, and 20 years is 80 to 85%. So basically saying after 10 years, 90 to 95% of individuals who go through this surgery are still going to be functional and doing quite well. And at 20 years, we see 80 to 85. So still very high numbers here. 50% of hip replacements patients are under 65 years old. So we are seeing younger ages participating in hip replacements and joint replacements in general. So usually with the younger patients, clients, they're going to have an easier time recovering, but not always the case. It's going to depend on many of the factors that we already talked about, their pre-existing conditioning and things like that. 34% are between ages 45 and 64, so we can see a growing number in these younger populations. 18 out of every 100 replacements require revision, so it's not perfect, right? Just like any surgeries, things can go wrong. There are complications. Certain situations might be harder than others. So I just want to keep that in mind. That then I know many are fearful of surgery, but it gets to a point where it likely is the best option. So we can at least have some numbers that show the success of this type of surgery. So and as the procedures get better and the parts get better and more durable, we're just going to see these numbers improve. Now, not like I mentioned, not all is going to go smoothly. There are some issues, and we don't want to assume that just by having the surgery everything is good to go, right? It's going to be a very big step in the right direction, but this is where their therapy and their training is going to come in after. We just have to realize that it's not an automatic recovery, right? There are things that you absolutely can improve upon by really devoting time and energy to the rehab process. And then even once the rehab is, officially over, just getting general strength and conditioning back so they can get back to the things that they want. So just keep that in mind, that there's many successes, and we're not sharing this to scare anyone, but just to know that we should demand the most out of this as possible, right? We're in pain. The joint is broken down. It needs to be replaced, and we want to make sure that you are going through the surgery and you're going to have the most successful outcome possible. But some things that we want to be aware of: patient-reported outcomes are often lower than performance-based functions. So basically saying how the patient feels they're doing versus some performance tests that, are they able to use the joint? Do they have that strength and ability? And are they where they should be based on the surgery? And so we're seeing that patient-reported outcomes and their performance tests aren't in a line, right? So they tend to think they're further along than they are. So we want to keep that in mind. Post-operative activity levels are disappointingly low in many patients. So we talked about how some do become more active, and just like anything, we're going to have those ranges. Some are going to, now that they're pain-free, they can actually do more things. Some are going to be fearful that, they were in pain, they don't want to go through pain again. We want to make sure that activity levels are increasing, right? Just moving is a huge advantage in the healing process. We want that blood flow, we want to prevent atrophy, and we want that strength maintenance, if not, developing more strength, so they can continue to do the things they need to do throughout the day. Around 20% of patients are socially isolated. So we just want to keep that in mind. We talked about that earlier, one of those factors that will influence success rate. So if they do feel socially isolated, if they don't have a support team around them, that could decrease the likelihood of their success. So we might be part of their support system, and we want to make sure that we are checking in as much as possible. You may only see them once or twice a week, but they should be doing stuff every day, and you should be following up with them to make sure they are doing it and they feel like you're part of their team and really helping them. And then finally, 5 to 20% of all patients report chronic pain after surgery. So, some of this might be directly related to the surgery, and that's when revisions may be necessary, but we want to make sure that we are managing pain as best we can, and not just with medication. Obviously, there's a time and place for that, but making sure that we're doing proper recovery and rehab, and doing appropriate exercise to make sure that they are successful. Okay, in this next part, we're going to go over the hip and the knee, and really just touch on the procedures a little bit. I want to spend most of the time in this webinar really diving into the exercises that we can be doing, whether it's pre-surgery or preventative, post-surgery, hip, knee. But we're going to touch on the replacements themselves. So we can see a nice picture here of what exactly we're dealing with. So we can see the acetabulum, so that the socket part of the ball and socket joint, and then we have that femoral head, the ball at the end of the femur, and essentially what we're seeing is they're cutting away at the acetabulum. That might be damaged there. We're going to see the femoral head. There's probably some damaging, arthritis, bone spurs, things like that. So they are going to remove those pieces and then essentially replace them with a prosthesis. So we see here both the acetabulum, the socket piece, and the femoral head are going to be replaced, and we see that replacement is actually going through the neck of the femur. So obviously strong bones are important. So we want to make sure that prosthesis really holds and can support the weight after the surgery. So the stronger that skeletal structure is before, the more likely they'll be successful afterwards. And this is where that training before surgery really comes in handy, making sure that system is able to handle all the stress that it's about to go through with surgery. Now, there are different surgical options. So we see the three most common here: that anterior, lateral, and posterior incision. Now, this is going to depend on quite a few different things, and obviously something we're not going to have control over. This is going to be based on the surgeon. So things like patient age, diagnosis, condition of the joint will influence what approach they feel is the best. Patient lifestyle and activity levels are going to be considered to make sure they're doing what is going to be the best fit for that client or patient. Surgeon's comfort level, right? So what are they most comfortable doing? They're obviously going to want to have the highest success rate, so they're going to stick to the ones that they feel the most comfortable with. And unfortunately, there's going to be an insurance aspect of it too. So all of these things are going to be considered on what type of surgery they're going to be going through. The main thing is we're just aware of what approach they did have, because we want to know what structures might have been torn or spread or damaged, and are still healing. You know, if you cut through a muscle, whether it's through a surgery or a muscle tear, that area is now vulnerable. It's going to atrophy. It's going to become weaker. It's going to be prone to future issues and injuries. So we want to make sure we understand what exactly is going on. So when we select our exercises, we're selecting ones that will help strengthen these areas to get them stronger and stronger, but also just be aware of any potential issues with those areas if we have limitations that we might be dealing with. So we just see a quick summary of what we have with each one. So our posterior approach, so the incisions from the greater trochanter to the PSIS through the back side. What they'll do here is split through the gluteus maximus and external hip rotators, so splitting through there to actually get to the joint. And when you see the muscles listed here, just realize if they're splitting or actually cutting through, it is damaging that area, and these are going to be muscles that we definitely want to make sure we strengthen post-surgery. We have our lateral incisions, so here we're going to have that small incision from the greater trochanter down the side of the femur. They're going to be splitting of glute maximus again and medius, and often the abductor weakness is going to be a primary concern, right? So the side of the hip, so really working on those abductors post-surgery. And we'll get into the specific exercises we want to focus on. And then we have the anterior, so the incisions between the sartorius and tensor fascia latae. Muscle damaging, sparing, so they're actually going between the muscles and not actually cutting through them, so a little less damage and issues there. We do see some fewer hip dislocations because of this, because there's less damaging and that joint can support itself a little bit better. And we have the image here of that anterior approach incision through the front of the hip. So we can, again, just see that there's pros and cons to each of these, and we're just aware of it so we understand any specific concerns that we might have with each of the different approaches. Now, once we're post-surgical, we do have some precautions. I think the biggest thing is making sure we're monitoring pain, right? Pain is going to be the most compelling indicator. There is going to be weakness. There is going to be some pain. We want to make sure we keep it manageable. We're not just masking it with medication. Obviously, we might need some medications, but we want to be aware of, hey, is this too much pain that they're dealing with? And something that we really need to be concerned with. After hip surgery, probably the biggest thing, obviously infection and things like that immediately post-surgery are going to be important, but we do want to make sure we're looking out for hip dislocation and falls are going to be some of the biggest things, especially that dislocation with the posterior approach. So we just want to make sure that we are aware that there's slightly higher risk with that particular approach, so it's something we might need to be aware of. And obviously, if anything that we're not comfortable with, or if emergency action is needed, we call 911 to make sure we take care of that and take care of our patients or clients as fast as possible. Now, post-surgery, many of these different approaches will have some restrictions or contraindications. Really, this is just a quick summary, but we just want to make sure we are letting or are understanding through our client or through the surgeon what particular movements are to be avoided. And we need to understand also, should that be a temporary restriction or a permanent restriction? So some of these different approaches require specific things that we're going to need to avoid, potentially just for a few months or up to a year, and then some that we can implement back in, and others we just have to really watch out for specific range of motions that we're taking the hips through. And really, if you think about it, we're looking at mainly the opposite movements of where the approach is, right? So if we're looking at the posterior approach, so the incision was on the back side of the hip, if we're just going to simplify this. So we know any stress going towards the back of the hip is going to be an issue there. So if it was a posterior approach
If I move the hip into flexion, that actually pushes the head of the femur back into the back of the acetabulum and stresses the back side of the joint there. So we know like excessive hip flexion is going to be an issue there. Now, if we look at the anterior approach, picture the opposite, right? So if I'm actually going through a lot of hip extension, I'm pushing the head of the femur anteriorly forward, and now that might be high risk movement. So going through too much extension of the joint. And then lateral, going through abduction, right? So if adduction, adduction, right? So if I'm bringing the knee in and pushing the head of the femur out laterally, that's going to cause some issues there. So we want optimal range of motion. So that's the main thing. We don't need excessive range of motion. And we also have to understand, are we loading these range of motions, or are we just taking it through gentle range of motion, right? So I want to move that joint as much as possible, but I want to stick within reason, right? They don't need to be doing splits and getting into crazy postures. They just need adequate range of motions that is going to help them get up and down stairs, whatever it might be. So we just want to make sure they have that type of range of motion. And as we're loading them, that changes things a little bit, and I want to make sure I'm avoided loaded positions at some of these end ranges. So just keep that in mind as we go through some of the different exercises. Okay, moving into the knee, here we have a nice picture of what's going on at the knee, and there's going to be a few different types of surgeries, not necessarily the same as the hip where we're talking about different approaches, but how much actually needs to be replaced. So we'll talk about full and partial replacements, but we can see a nice picture of the joint here, and there's a breakdown somewhere. So this could be maybe that meniscus is wearing out and the cartilage, and we have some of that bone on bone or arthritis, whatever it might be. So we need to replace some of the parts here. So we're going to see the top of the tibia being replaced, the end of the femur being replaced, and even that behind the patella being replaced as well. So all these different areas are probably impacted in some way through that joint degeneration. So like I said, some of our options that we might see are total knee replacement. So just like we said, so the head of the femur and the tibia all are going to be replaced there with the prosthesis and put back together. Our partial knee replacement, it could be one or the other side is replaced. So there might be only damage on the medial side or maybe on the lateral side, just one piece. So it's not going to be the entire knee that is replaced. There might be a patella replacement, so resurfacing the back of the patella in front of the femur. So again, kind of that partial knee replacement, just specific parts of that knee. And then finally, the revision knee replacement. So now replacing a failed knee replacement with new prosthesis. So like we said with some of the numbers we looked at earlier, it is rare, but there are still a percentage of cases that they will have to go back in and replace some of those pieces. All right, some things to be concerned with post-surgery, specifically with the knee. We do see, again, pain is the most compelling indicator. So again, we're trying to keep things at a comfortable level, but no, there may be some pain initially, and we want to make sure we are managing it to the best of our ability. One thing to be aware of, that fat pad is removed during surgery that we see behind the patella. So we see a nice picture of it here, that yellow area. That being removed can make kneeling painful after surgery. So I want to keep that in mind. Again, this is a great time to talk with both the client and the surgeon or their doctor if possible to know, is kneeling something that they can do or they cannot do, again, temporary or permanently. It is uncomfortable for many, but sometimes using appropriate padding, they can still do kneeling exercises and it's still appropriate. And sometimes a great exercise selection we can do if they can get on all fours or kneeling, but just realize this might be a case-by-case basis where you can do this for some clients and you cannot do it for others. So you just want to know, is this something that we can do? Sometimes they're fine, and I've noticed with a lot of my clients, it's just we can't spend a lot of time there just because it becomes very uncomfortable after a while. So not that it's going to damage things, but they'd be very uncomfortable and they don't want to spend much time in that position. So we might do a single set of an exercise and we're just there for 20, 30 seconds and then we're off and on their back or changing positions so they don't have to be kneeling for a very long time. Another point I always like to bring up, swelling. So swelling is something that may continue to happen
post-surgery for a little while, and we want to make sure that we realize that swelling of the knee leads to decreased quad activation. Now, this is true with any type of knee swelling, so just good to know if somebody just has a knee injury and there's some swelling of the knee. Just keep in mind it changes muscle activation. You're going to see a reduction in quad activation. And I bring this up because it means they are going to start to change the way they move, right? So I might be squatting, and if that quad can't fire enough to support that movement, what are they going to do to compensate in order to make that happen? So we want to make sure we at least keep this in mind. We're doing single leg exercises as much as we can, so they're not just continuing to rely on the other side. But just know in periods of higher inflammation, we might need to back off a little bit less volume. So we're keeping that in mind and not leading to any problems down the road. If that swelling continues, just keep in mind this potentially could be a sign of infection, and that's going to be a big thing with knee replacements. Is just really paying attention. Is there any type of infection going on? Is that for something that further medical treatment is needed? Obviously, just like with the hip as well, we really want to watch out and pay attention to falls, because this can be a big problem. So we're choosing appropriate exercises, right? We do want to challenge them and improve balance, but we have to do it at the appropriate levels. Okay, some expectations again, just to continue post-surgery. Total knee replacement is the most common inpatient surgical procedure within the U.S. So obviously it's something growing and growing. Functional performance worsens 20 to 25% 1 month following surgery. So we want to make sure as soon as possible they are up and moving. There is a lot of healing being done in that first month, and we want to make sure they are doing their therapy and they are moving. Again, not too much, but just something to keep moving and keep those joints and muscles active. And probably the most important thing, keep that blood flow going. Even if they can do stuff completely unrelated to their knee or their hip, just to increase blood flow, doing something like a hand bike or just something, getting in a pool to get blood flowing and helping in the healing process. So we know that there's a significant decrease in performance 1 month following surgery. So we want to help improve that as much as possible. We see knee extensor strength decreases up to 35% 1 to 2 years following surgery. And this is a big problem and influences a lot of other things. Obviously, if we're weaker, we see an impact in the rest of our life. Lower body strength, especially quad strength, is correlated to mortality, right? So if we don't want to go down that road, right? We're trying to get our clients thriving for as long as possible, and there's many factors that we can look at that kind of help us see, who's at risk for early mortality. And lower strength of the lower body, less strength of the lower body is high up on that list. So we want to make sure we're doing everything possible to build that strength back, because we can see 1 to 2 years post-surgery. So even after the therapy is over and after they've healed, if they aren't doing something about it, we are going to see some significant decreases there. And again, just shows the importance of fitness and exercise. And unfortunately, we see this last point here. Some reports show as low as 26% enrollment in therapy. So just not even attending therapy or potentially not finishing therapy. And really, that's just the start. You're only going to see minimal gains once you've completed your, kind of standard physical therapy. That's maybe just getting them back to, where they were pre-surgery, which was probably not a great place to start from. So our goal is to surpass that. So we want to make sure that, hey, you're staying active. We're working on all these things that we're going to talk about, because we want to get you back to functioning as fast as possible and get you further. And that was the whole point of the surgery, was to get you better than where you once were. So we just want to keep all these numbers in mind here.
Let's move into part 3, where we're going to talk about specifically exercise programming goals and things that you want to consider when working with your client for both total hip and total knee replacement. Keep in mind, I'm not going to break these down into, do these for the hip, do these for the knee, because I really think all the exercises you're going to see are pretty much appropriate for all of these different surgeries that we're talking about. So really, you're going to follow the system. We kind of lay it out in a progression that you can do, and you're going to choose, what's the best fit with the client that you see in front of you. But as you see the things on the screen right now, these are going to be critical for both replacements, right? So we need to look at what's their range of motion, right? So if they've gone through therapy, hopefully they've restored optimal range of motion. If not, this is something that we're going to have to continue. And it's not just the joint that was replaced that we're talking about. So it's not just the knee, it's not just the hip. It's really everything, right? I want to look at the hip, the knee, the ankle, and see how it all works together, comparing left and right sides, making sure that they're within reason. It might have been bilateral replacements, unilateral replacements. There's lots of different scenarios that we're going to be faced with, but we want to make sure, what's that range of motion look like? Can we restore it as best as possible? What's their strength look like? And how well do they control range of motion and that stability? So we want to look at improving all of these different things. We want to look, obviously we're going to integrate strength training and conditioning. Now, keep in mind, a lot of times we want to focus on, or what should I do for the knee? What should I do for the hip? But focus on the things you can do. Especially, the closer it is to the surgery, we just want to get them moving. And I keep bringing this up, and I'm going to keep stressing it because I think we sometimes skip right over that, right? Just movement in general is going to be good. So incorporating upper body movement, whatever they can do to improve overall strength. So just keep that in mind. We're not just going to focus on the hip and the knee. We really need to continue doing all the things that they can do and really focus on that to get as much movement as possible. And then you're going to integrate other types of training specifically for the hip and the knee, but just keep that in mind. I want to make sure I'm focusing on ambulation, that they can walk around and get around and again, get around the house, do the things that they need to do throughout the day, so we can do specific drills to help with that. We've mentioned a few times with fall risk, I want to make sure that I am paying attention to that with the exercises I select. Like I mentioned, I do want to challenge their balance, but I have to do it in a safe environment, and I want to make sure I'm focusing all the things to improve balance and strength, lower body strength, that are going to help reducing fall risk. Aerobic capacity, I don't think it's talked about enough, but we want to make sure that they're just fit and they're able to get past this surgery and get back to what they need to do. Now think, if they haven't been doing a whole lot, maybe they were in a lot of pain waiting for this surgery and now they know they need to do something once the surgery is over, their aerobic capacity is probably very, very low. VO2 max is down, and these are all not good signs for a lot of different reasons in health, not just fitness. So we want to make sure we're doing everything possible to continue to improve aerobic capacity by any means we can, right? So whatever it takes to get their heart rate elevated for extended period of time, we need to get them do it. If it's walking on a bike, in the pool, whatever they can do. When we're looking specifically, plus or minus 90 days post-op, the client should be at or beyond pre-surgical levels. Typically, this isn't deficient to begin with, but we want to make sure 90 days out, they're at least where they were strength-wise, range of motion-wise, since before the surgery. So that's something that hopefully they've already accomplished with their therapy. Unfortunately, when we hit about the 90 days, that's when you see a lot of insurances won't cover therapy anymore. And if you think about it, this is really unfortunate because they're really not where they need to be. They're just getting back to where they were, which was probably deficient to begin with. So at that 90-day mark, we really need to make sure we are continuing to push them and making those gains. So hopefully they do their full therapy, and then they can work with the trainer to get them beyond those levels, which is what we ultimately strive for. Okay, a few things before working with these types of clients. Obviously, we want to make sure they are discharged. It is always a great idea to have a good relationship with their therapists, just to make sure that you guys are on the same page and we're focusing on the things we need to focus on. They can give you a lot of information on things that their patient's doing quite well, or maybe where they need some improvements. So at least you have a great starting point. I do recommend doing your own assessments, which we'll talk about, but at least having another recommendation to help you get started, it'll go a long way. But obviously make sure they are discharged and they are cleared for exercise. Exercise with caution for 3 months unless the doctor or physical therapist says otherwise. So we just want to make sure we are erring on the side of caution and we are getting them moving, but we're don't overload the system too much. We're in the beginning, it's just general stability and movement and, getting blood flow throughout the body, working on range of motion, things like that. So if you're following a good progressive program, this is something you're probably already doing, but just keep that in mind that for the first 3 months, we're going to ease into it. As I mentioned, beware of any movement contraindications. So, based on recommendations from their surgeon or their physical therapist, what are some things that they should or should not be doing? So just make sure we get all that straightened out. We want to make sure we assess their pain levels so we know what type of pain they are currently in. Is it, like I mentioned previously, is it manageable? And, are we focusing on not making those pain levels worse by the activities that we choose? So in the beginning, you're going to do the best you can to focus on as much pain-free movement as possible. Obviously, there will be some discomfort, but if it's something that the next day they just can't do anything, this is something we know we obviously went too far, too soon, so we have to back off a little bit. We want to understand, are they on painkillers, antibiotics? What kind of medication are they on? Are there going to be any effects that would impact their exercise, their balance, their focus, whatever it might be? So just have a good idea of what type of medication that they are on. Maybe you can structure your workout around some of those things. Obviously, if there's pain, swelling, inflammation, anything out of the ordinary, we're going to stop activity, refer back if necessary. If it's something that is just chronically getting worse, obviously we should see improvements each session to the next. So if we're seeing the opposite, it's something we want to make sure we refer back and just get that taken care of. And then obviously if they are using assistive devices, hopefully eventually they will get off of those. But in the beginning, we want to make sure they are using that support when needed, and then slowly progressing them away to unassisted exercise and movement. A couple other things that I do want to bring up before we get into the specific exercises. Blood clotting is something for both knee and hip replacement that we may be concerned with. And oftentimes there will be anti-thrombosis medication given to the clients. Here's some pretty interesting research showing that 40 to 60% of patients that did not receive anti-thrombosis medication were diagnosed with a blood clot or pulmonary embolism after the surgery. So that's a pretty high number. So just keep that in mind. It's something to pay attention to if we have any signs or symptoms that there's some type of clotting or issue going on. Just at least early on recovery, paying attention to those things. And then obviously muscle loss is going to be a big thing, right? If they are inactive and they're staying off those muscles while they're recovering from the surgery and maybe beforehand because of the pain, we want to focus on building that muscle tissue back. Focus on hypertrophy, really get that muscle not just strong, but often you're going to see that side has significantly got smaller. We're going to be talking about some assessments that you can do. Girth measurements might be something you want to do, measuring the thigh, the calf, just seeing is there a significant decrease and are we making improvements and bringing back some of that muscle tissue as well. So focusing on that muscle building, and like I mentioned, upper body exercise as well. Remember, hopefully the arms are working just fine, and we can really work on focusing on strengthening that upper body, because there will be a crossover effect. They will see some benefit to the lower body by training upper body. So it's something that we can at least focus on there with maybe some of our more intense type exercise while we are slowly integrating back the lower body. Okay, like I mentioned, we want to make sure we know our clients are improving. We want to know where they're starting from. So it's always a good idea to have some type of testing and assessing and screening to just make sure we understand where our clients are, where they need to go, and that they are seeing improvements throughout our training. So we want to make sure we use different movement screens and testing in order to do so. And these are just a few that I've listed here, but just think about all the things that you want to see improvements on. So we might use movement screens so we can just make sure, how do they move? Both upper and lower body. Can they do basic movement patterns, our squatting and our hinging, pushing, pulling, things like that they understand how to do these basic movement patterns. And it's kind of like they can or they can't. And if they can't, those are, again, it's telling us what we need to work on and maybe things that we want to avoid for right now. If we know that they can't get into a squat position yet, maybe we're going to do more things that work on mobility before we, load up a squat and have them do lots and lots of repetitions of a squat. So we're going to find, what are our priorities to work on for improving those different movement patterns, and where maybe they move pretty well. And like I said, maybe the upper body works great, and we can really push those areas. So that's the idea of the movement screen. There's a few of them out there. Functional movement screen is one of the big ones. So it just gives you kind of an idea of how well they move and where we should prioritize specific types of training. We might look at performance testing as well. So just functional performance testing, just to see how they can complete certain tasks that will involve strength and balance, coordination, power, all these different things that they need to do. So again, just a few ones: a time, get up and go. So how fast they can get up, walk, come back, sit down. There's standards for a lot of these different tests that you see here. So you can look up and see where, what their times or reps or duration that we should see, how it compares to other people within their population. So these are pretty easy to find. But again, just giving you some ideas on things that we want to measure. Sit to stand, looking at more of a muscular endurance, single leg balance. Can they stand on one leg for 10 seconds? Both legs, are they pretty equal? Can we add higher level of challenges? Like I said, sometimes these testing that we'll do are just really telling us where's a good starting point. If I have a client who can't stand on one leg for 1 second, obviously I'm going to regress and try and get some fairly fundamental balance drills that they're going to be successful with. Or I have a client that they actually do great and they can balance on one leg for 20 seconds. And they can do it with their eyes closed, right? So it's just telling me, all right, this person needs higher level balance drills. So we have a good starting point. We might look at walking speed. So if we just get on a treadmill and just see what they choose to walk at, and we can see what they feel comfortable with, and over time we should see they should be more comfortable walking at faster speeds, or even setting up a cadence to see if they can keep up with certain speeds. So there's lots of different ways that we can look at their ability to perform tasks and get that baseline, perform our training every 4 to 6 weeks. Maybe we pick one that they were really struggling with, and let's see, did we make significant improvements there? If we did, we're on the right track. Let's keep doing it. If we didn't, we might have to focus on a new program or changing things up to get that improvement there. Okay, so let's get into the specific training. So we broke it down into a few different phases, so you kind of have a general idea of what the focus is. Now you'll see some general guidelines too. So phase 1, we're looking at the first 4 to 6 weeks post-therapy. Now for some, this might be 2 weeks, and then we're going to move on to the next phase, and some it might be 8 weeks, 12 weeks, right? So really, you progress them when they're ready to progress. And you'll know that when the exercises you're selecting, based off of the things that we focus on in this phase, they can do pretty easily, right? It's no longer a challenge for them. So now we're going to start to progress into the next phase, and each phase is going to follow this similar pattern. You're going to progress when they're ready to progress. Don't rely on a specific timeline to follow. Focus on the client in front of you, and you'll have some that progress fast and some that may be a little bit slower, and we progress them whenever they need to. So in our first phase, our primary goals are going to be improve or maintain ankle, hip, knee range of motion. So really focusing on that lower body, obviously the upper body too, but when we're focusing for these specific surgeries, we really want to focus on what's going on with the lower body. So we want to make sure we focus on those joints, we get them moving a little bit better. We want to make sure we improve muscle activation and strength levels of the lower body. So a lot of it's, lower level strength exercises, almost awareness exercises to just be aware of what muscles should be engaged and focus on training those. areas. And remember, some of these muscles are probably still pretty weak, pretty new out of therapy. So we're just going to continue really strengthening a lot of those stabilizer muscles to really help support that joint, and then eventually add in more and more movement. Core stability is going to be a big one. If that core is not stable, it's obviously going to have a lot of negative impact in their movement. If the joints of the lower body, like the knee and the hip, were affected, oftentimes we lose lumbar spine stability because of the hips, for example, not moving the way that they should. So we really want to make sure we improve that stability, which oftentimes when we do that, we see the hips moving better. That's going to be a big focus here. We're going to really work on improving balance and stability. Like I mentioned before, fall risk is something we're always concerned with, so we really want to make sure we get them good on one leg. Now, we've had the surgery, we've had pain, we've been dealing with these issues, and that is absolutely affecting the neuromuscular system. So how the brain and the muscle communicates to each other, how our proprioceptors work, they've essentially been disrupted. So we need to build that back up. So we want to make sure we're definitely improving or working on some drills to improve this area here. And then one continuing theme you're going to see is enhancing aerobic fitness. So by any means we can, we're always going to be working on improving that aerobic capacity on top of all of the other things that we're trying to accomplish here. So just going to go through a few exercises, and these are just a few that we might implement in this phase. So this first one here, just working on that ankle. The ankle has been shown to just be so important for pretty much all functional movements that we do. And when they've gone through hip and knee replacements, we know the ankle is going to be affected, right? So everything below those joints is going to be affected. If they've been babying that aside or not using it as much, they are going to start to see that range of motion go away. So it's really important that we work on the ankle. So here are just some ankle pumps. So we're down on the floor on their back, and we're just going to go through some simple ankle pumps. So we're going to go through plantar flexion and dorsiflexion. Yes, they're getting a little hamstring stretch here too. And then we're going to go through some circles. The big thing here that I really like to focus on with many of our mobility drills is to make sure they're aware of what movement should be occurring and what movement shouldn't. Here, we should see very little leg movement. All of the movements occurring at the ankle. When the ankles are super tight, you're going to see the entire leg start to move. So they have a really hard time pointing and flexing, so you see them get a lot of knee movement in there potentially. And when they do the circles, you actually don't see the ankle moving, you just see the hip rotating. So just keep in mind, really watch out for that and make sure that they are focusing on that correct movement there. All right. Now, obviously, we want to incorporate a lot more mobility drills, hip mobility drills, but that was just one that I really like to throw in there because we often forget about the ankle. We also mentioned we need some muscle activation, and with most of our approaches, there's going to be some issues with the glutes, right? So we have some problems just engaging them and really understanding what the glutes need to be doing. So these are just a few drills that the primary focus is just to get them to understand what that means when you say squeeze your glutes or engage your glutes or whatever term you want to use. Squeezing your butt is essentially what we're trying to do here. So it's just creating awareness. So in this first drill, we're just going to be seated, and it looks kind of funny, but all they're going to try and do is basically try and get taller by squeezing their butt. So when they squeeze those glute muscles, you should see it engage, and you're going to see it in the video here, and they actually get a little bit taller, right? So we just see them pop up. So we're just going to squeeze and go back down, squeeze and go back down. We're just doing it from a seated position. Here, I'm going to see, can she just squeeze one side, then squeeze the other side? She struggles a little bit, but she starts to get it. All we're trying to do here is create awareness, create some engagement of these muscles that we're talking about. So the double glute squeeze, just trying to get tall, come back down, get tall, and then see if they're coordinated enough to get the one versus the other. And after surgery, this is something that's going to be a little bit tricky. All right, here we have a straight-legged bridge. Yes, you can do bent-legged bridges, but I do like starting with this straight-legged bridge. And we're just going to have their feet elevated a little bit, and they're just thinking about digging their heels into that platform and then driving the hips up into extension. Then we can go single leg. So obviously this is going to be a lot tougher, but if we want to focus on that one side, we can do that single leg glute bridge as well. Notice it's not a big movement. So we're just focusing on really basically like that butt squeeze again. I just want to see them a little bit of hip extension and raise up. You do want to pay attention to their feet. You can see as she gets tired, her feet are going to start to turn out. We want to make sure they're using the appropriate muscles here. So make sure those toes are pointing up, especially when we go straight legged. It's really easy for them just to rotate and turn that toe out. So you can see I keep trying to tell her, you can't hear me in the video, but I am trying to cue her to point that toe up, and you can see sometimes she tries to fix it, but she'll tend to go back to her bad habits and start to turn them out. So here she straightens them, and then after a few reps she loses it as they turn out a little bit. So just keep an eye on that so we don't develop any compensations. When we go to that single leg, do make sure that they hip. She can hug it or have the hands for support, whatever they need there. We just want to make sure that hip is flexed more than 90 degrees. That's going to help limit the lumbar spine involvement, so we can really focus on that hip extension and not lumbar extension. All right, here we're working on core stability with hip mobility. So we're going to do a core engaged leg raise. So we know when the core engages first, the hip joint moves a little bit easier because the pelvis is being stabilized properly. So that's all we're trying to teach them here is we're going to get them to engage their core, and then I'm just going to have them do a straight-legged leg lift with one leg at a time. It's important that we do this in steps though. You want to make sure they pull the band first, hold it there to get that core to engage. It's really going to force them. I could just say squeeze your core, but a lot of people won't understand what that means or they're going to lose it. By doing the band pull, it really just forces them to engage that core. So we're going to pull the band, hold it, and then we lift the leg, lower the leg, and then relax the core. Right? So we just repeat that cycle. Engage the core, lift the leg, lower the leg, and then relax the arm. So just a great exercise to get core stability with a little bit of hip mobility at the same time. All right, here we're doing some single leg knee flexion. So great for getting some movement in that knee, working on that hamstring strength a little bit plus knee range of motion. So we're just using a slider. I like using the sliders because it's either very easy if it's on a smooth surface, or if you cue them to push their heel into the ground, it's going to increase the friction, making those hamstrings work a little bit harder. So we have a couple variations here. So it's literally just seeing how much flexion they can go through and then into extension. And I'm just cueing her, hey, why don't you dig your heel into that slider, making it as hard as you can maintain, right? So I want to make sure that she's in a good position the whole time, but we're just digging that heel in and working on that knee flexion. Here we're just adding a little bit of a challenge, so I just have a band tied to her, so she has to not only push the heel into the ground, but pull the band. So we do get a little bit of hip flexion work here, which is great. So just getting both sides of the hip here, which is a good exercise to achieve that. This next exercise, the stability ball rock back, I'm a big fan of for a lot of different reasons. So with a lot of the previous exercises, we were laying on the ground and supported. Now we're going in the quadruped position, so it's going to be slightly more challenging because we're going to be fighting gravity a little bit here. Now, obviously in some situations, we're on all fours, we're on the knees, so in some knee replacements, we're not going to be able to get into this position. This is a great exercise for hip replacement, but also those that can tolerate kneeling, we might add some pads underneath there. That's always an option as well. But the reason I love this exercise is what it's trying to teach the client to do, and that is to really understand how to stabilize the core properly. And it's going to force them to do it without really thinking about it. A lot of times when we say, I want you to squeeze your abs, they don't quite get what we're trying to ask them to do because we need some of those deeper muscles to stabilize. A lot of the deep stabilizers, the muscles that surround the spine that are a little bit harder to consciously engage, we can get them to reflexively contract in the right scenario. Now, first, we need to make sure that the spine and the hips are in a good position. So if we're in a good neutral spine, they have a better opportunity to do the job that they're supposed to do, which is stabilize. Then if we add a little bit of compressive force, we can get them to naturally engage. And now when we hear that combination of compression and spine, we usually think of a bad thing. But when the spine is in good alignment and we add a little bit of compressive force, we get these muscles to do exactly what they're supposed to do. So this is a way to put them in a very safe environment to do so. So we get them on all fours, we make sure they understand what neutral spine is, and we get them in a good position. Then we are going to add a compressive force, not by loading their back like a back squat, but actually doing it from the bottoms up. We're going to have them push their hips into a ball, into the wall. And this is going to create that compressive force. And just by trying to squeeze that ball as hard as they can with their backside, they are going to get an incredible amount of core activation here. So that is simply the drill, and it's just teaching them, hey, get good alignment, and then let's create that force. Now you have to be careful when they push into the ball. They want to make sure that there's no change in that spine alignment. A lot of people will tuck their butt under and tuck the pelvis into that posterior pelvic tilt. We will eventually add a challenge. You see here, she's struggling a little bit. We're going to ask her to lift one hand off the ground. So we add that compressive force, and then we're going to add a rotational force by lifting one arm off the ground. So we start with just the compressive force. We push into the ball. It's just trying to teach them, hey, we're going to put you in good alignment. I'm just going to challenge you with this little pressure here, and I want to make sure you maintain it. Once they've understand that, now we're just going to add an extra force. So we're in that transverse plane now, and see, can you stabilize if I change your base of support? You may have to get their feet a little bit wider initially and their hands a little bit closer to help them out in this position. But great exercise to just teach that initial core engagement that a lot of people struggle with. So that is a great teaching tool, and then eventually we might progress to a hip extension or a leg slide like we see here. Think of, like a bird dog exercise, but we're just going to be focusing on the lower body and really extending the hip. Now here's the big thing when people do an exercise like this. They often substitute hip extension with lumbar extension, and that's why we did the previous exercise, to teach them how to really get good stability in that core. If it's somebody who's been dealing with the hip issues that eventually is going to get a hip replacement, or is previously just had one, we know there were some hip issues, and they probably lost a lot of hip range of motion, which is why we're hopefully working on it here. If that hip loss range of motion, we know it's going to the body will make up for it somewhere, and it often gets it from the lumbar spine. So a lot of times we see flexion when we should see flexion and extension of the hip. We see flexion and extension of the spine. So that's what essentially we're trying to reteach them how to do. Stabilize the spine first, then we flex and extend. And that's all we're doing with this exercise. So we're going to use a slider. When most people extend their hip behind them, like for example in a bird dog, we're going to see them just go too high, too much range of motion, and they extend right into that lumbar spine. If you have a client that has tight hip flexors, that means they cannot extend their hip fully. They're going to have a hard time doing it. And if they try to, they're going to run out of room, right? The hip flexors are going to prevent that movement from happening, and they will make up the difference with the lumbar spine. So help them out by shortening that range of motion, and that's why I really like to use the sliders. We're using band for a little bit of resistance because I want them to really feel that resistance so they extend from where I want them to extend, and that's the glutes, right? So we teach that core stability, then we teach them how to extend the hip with the glutes, and that's what we're trying to do in this exercise. We're going to push that slider away and really stretch out that band as far as they can. I like using the band because they really have to reach. It gives them something to think about. I want you to stretch it out as far as you can, not high, just far. And we can see, if you look at the lumbar spine, we see pretty much no movement at all. All of the movement here is occurring at the hip in both flexion and extension. Both movements are important, so I want to make sure, hey, can you flex and extend from the hip, not the lumbar spine? Eventually we might get rid of the glider and we'll have them extend back, but I want to be careful of how much range of motion that they get. So just a simple exercise, but a great way to teach them that core stability with some hip movement and flexion and extension. Then we're going to get them upright. We're going to change the planes of motion a little bit. We're going to be going side to side in that frontal plane and do some side stepping here. So we have same exercise, just two variations. One, we're going to have the band around the hips, which is going to make it more of a hip resisted exercise. And then when we raise the band up around the chest, it's going to be a little bit more core involvement. So always start a little bit lower, It's going to be easier to manage the resistance, and then we can move up from there. But all we're going to have them do is take a few steps out and a few steps back, and we're just working on controlling that core, shifting the weight side to side, and using those hips in the frontal plane. So they're what we want them to think about is when they're stepping away from the wall, they're pushing themselves away with the left foot, and then they're going to slow themselves back down. So they stretch out that band, and as they come back, they have to work on slowing themselves down because the band is going to want to pull them back faster than they typically would. So they really have to control that resistance there. Here, same exact exercise, but you can see she's struggling a little bit to maintain that posture. We want to see that center of gravity going straight up and down, and now it's challenging her. So she feels it pull, which is fine, right? We're not going to see perfect movement every time. Really what I'm looking for is if I challenge you and it takes you off of that center, can you adapt and correct it? And that's what she does. She gets her balance back, and then she starts to walk. We just want to make sure that that the resistance isn't too much that they can't regain that control as they go. Here we're going to use bands again, just to add a little bit of resistance in different planes of motion, and then we're just going to march. So we're just going to do a little dynamic balance drill, get them shifting their weight side to side. A lot of the drills, you see us repeating this weight shift. So they put weight on one leg and then on the other. They can control it, and they can balance dynamically there. So we're just having them march in place with first the band's pulling them forward. So their goal is to just march in place. It should just be a nice tall posture, and don't let the band affect you at all. And then we'll just turn 90 degrees. Now we have that resistance in the frontal plane. And again, I want to see, can they march and maintain that balance in that posture? And then we can keep turning. Now it's pulling us backwards. We're going to have to keep the hips extended. And then we just stay nice and tall as we do our marching. So just a nice dynamic balance drill. And then obviously we can turn again and get the other side. So single leg supported exercises are, I think, a nice transition, right? So there's a million different balance drills we can do, and we definitely want to get them one leg. And marching is a great kind of introduction to single leg. You're not on one leg for very long, but you're on one leg. So it's kind of introducing you to standing on one leg. Now, going to single leg exercises can be very challenging. And if you're, just standing on one leg is very challenging for many people. Then if you're asking them to do an exercise on one leg, then it's, very, very difficult. And sometimes it's just too big of a jump from what they were previously doing. And that's why I really like using the single leg supported stance. So we can see basically all we're doing is putting one leg up on a step. So it's almost like we're standing on one leg, but we have both feet in contact with something. Now in the beginning, we might say, you're going to keep pretty equal force or weight on both feet. So it's like a 50-50 split. So I might just be standing there and having one foot up. I want to pay attention to that back foot and make sure it's standing, pointing nice and straight forward. A lot of people are going to want to open up because of tightness in the hip or the ankle, and you're going to see that foot turn out. But I want to make sure that it stays straight the entire time. Once they get comfortable there, then we're going to start to shift that weight back onto the back leg. Now I might say, hey, I want 60% on that stance leg, 40% on the step leg, then 70-30, 80-20, 90-10, and keep working on getting less and less weight on the actual step. I eventually get to a point where the foot's on there, but I'll tell them, hey, I want you to pretend like you're standing on an eggshell and don't crush that egg. So most of the weight's on that back leg, just a very little bit on the front leg. And then eventually we can have them lift that leg off the ground or off the step. And so they are standing on one leg, but it's just hovering over that step. So it's there in case they need it. And if they need to put it down and rest, or if they lose their balance, they can just reset and start over. So it's a nice way to progress to that single leg stance. So I just have a couple exercises here. There's, hundreds of exercises you can do. I really wanted to just discuss the posture of being on one leg and with this single leg support, and then throw in whatever exercises you like. So just for example, and I apologize for the small picture here, but we're just doing a light med ball toss. So I'm just throwing the ball in different areas. She has to catch it, maintain her balance, trying to keep as much weight on that back leg as possible as she tosses the ball back and forth. So we can do something like this. Or think of, strength exercise. I can do a row, a push, curls, anything. I'm just trying to expose them as much as possible to that single leg stance and we're just doing it with this little bit of support here. So I'm trying to get them as much weight on that back leg. You can see nice alignment, the ankle, the knee, the hip, the shoulders, the ear, all in a nice straight line. That's what we're trying to maintain. You're going to see some people when they are getting tired or nervous, they might start to shift their body forward. It's okay to have some weight on that front leg, but I want to make sure I keep that nice alignment through that back leg there. Before we get into phase 2, I just wanted to recap everything that we talked about in our phase 1 training. So remember the goals. We were really trying to work on that range of motion, focusing on the ankles and the hips and the knee, just making sure those joints are moving the way that they're supposed to the best of our ability. Now, I know with each of these things, we only covered a couple exercises, but when you kind of understand what we're working on, you know, the possibilities are endless, and you already are doing a lot of exercises already. Hopefully this is just helping you organize them into a system to make it easier for you to progress your clients through that are working with hip and knee replacements or getting ready for these surgeries. So remember, those that are trying to get stronger and prepare for the surgery, phase 1 I think is still a great starting point. We want to make sure we're managing pain, and I feel really confident that they'll be able to handle a lot of the exercises that we are talking about in phase 1. Some may be okay for phase 2, but I think phase 1 is going to be a great starting point for those pre-op, and then once they get through the surgery, we start them right back there and progress through. Really focusing on that balance, control, core control, getting them in good alignment. So just those basic things, it's going to be a great starting point. And then we'll eventually progress into our phase 2. So again, you know, roughly 4 to 6 weeks we're going to be here. It will depend on the person. They might be here longer, they might be here shorter, but just to give you a general idea. So we're really just building off all of the things that we were just talking about. So now I don't want to forget about anything we just did. I want to maintain and improve range of motion as much as possible. Now the big thing is they're hopefully aware. They're more aware of their body and certain areas, their core, their hips, their ankles. They understand how these joints move, and they feel more confident engaging some of these things. So now we want to integrate more functional movements, squatting, hip hinging, lunging, step ups, things like that. But we may not be ready to fully load them yet, because I want to make sure that we get them strong enough, one, to just handle their own body weight through good range of motion. So what we're going to really focus on in this phase is more assisted exercises. So we're going to assist them in any way possible to get as much range of motion and to make sure we're not creating any compensations, right? If we progress too fast, they'll be able to do the movement, but they're going to start to pick up some bad habits, and they're going to get harder and harder to break later on. Anytime we can incorporate single leg movement, this is going to be really crucial here. We want to manage those asymmetries as best we can. We're going to keep progressing core and balance. These are going to be always around, so we just want to make sure we're appropriately progressing them so they have good core control, they have good balance statically and dynamically. And then don't forget, we're always working on improving that aerobic fitness, right? So we're always getting that aerobic work in any way that we can. And again, I'm going to keep repeating it, but we're working on other things as well, right? We're getting their upper body strong. We're focusing on the pieces that we know they can move and getting those strong. These are just concerns for the areas that were affected by the surgery. So we're going to keep improving those as best we can. So we're just going to show a couple exercises going through some of our big movement patterns. So starting with squats. And you're going to see really the two biggest things are we're going to focus on the load. And in this case, we are trying to help them with the load. They may not be ready to do full body weight yet. So I'm going to help them out, give them assistance. So I might use something like a TRX or a suspension trainer. We might use bands to help offset their load a little bit. You might be in the pool and doing exercises in there. All these are great ways to help them understand how to do the movement better. And we're going to get them through maybe better range of motion than they could at that current level. Then we have to manage any compensations that we see. And we might, give them different cues. We might, set up specific drills to help with that. So that's exactly what we see here. So some of our big concerns with squatting are they getting adequate depth? Are they in good alignment? And what are those knees doing? Are the knees caving in? We know probably some hip issues with both the knee and hip replacement surgeries. So a lot of times we see those ankles start, or the ankle tightness leading to those knees caving in. So we're just going to give them a little bit of feedback by placing a band around the thighs or above the knees, and we can cue them to just stretch that band out as you go down, right? So we want to make sure that they're not collapsing into that valgus position. So as they squat down, they are going to drive the knees apart, and they're going to use those straps as much as they need to. They're going to squat to a level that we see as being appropriate for that person, stand up nice and tall, and as they go down, they're just trying to stretch that band out. We just want to make sure, does everything look like it's in good alignment, right? Just keeping that weight pretty evenly distributed on our feet. The knees are pressing out. We see a nice upright posture. See the shin angle and torso angle are pretty parallel. So it looks like a pretty good squat there, right? So we're just trying to help them get into the best position as possible, and we're just going to assist the pattern. Hip hinging, obviously deadlifting, especially after knee and hip replacements, can be very, very challenging because the hips just don't want to move the same way they did before. So we really want to take some time and teach that hip hinge. And there's obviously a number of different exercises we can do. I'm going to at least talk about a few, and we have the video here of the hip hinge with core activation. But there's a number of different nice teaching drills to really help them understand how to really shift their weight back and push those hips back, and creating a nice hip hinge. So here, we know if we get the core engaged, just like we've been talking about, the hips, really the rest of the body start to move a lot easier. So that's what we're trying to do. We're going to actually engage the lats in particular. I know that lats aren't always talked about as a core muscle, but they're one of the biggest core muscles that we have. And we are going to engage those lats to help keep the shoulders in a good alignment and just help with this hip hinging. So what we have here is a band just wrapped around a post and attached to a dowel rod or PVC pipe. And what they're going to do is just keep the dowel as close to their body as possible. So as the band's trying to pull them away, they have to fight back and really use those lats to maintain that good alignment there. Now, we do want to make sure that they understand how to drive those hips back. So there's other drills that we might use, like standing in front of a wall and just trying to reach back and touch their hips to the wall, just so they really understand the hip hinge. And this is just helping really getting them to understand that movement a little bit better. So they just slide the band down, or the dowel rod down, and then stand back up. You can see at the bottom, she does lose a little bit of stability in the shoulders, and they start to round a little bit. So we could shorten that range of motion, because she looks pretty good until she gets past her knees, and then she really starts to reach just a little bit too far. So if it's not something that I can correct with a few cues, we might just say, let's shorten the range of motion for now, and we'll keep working on that. I might give the cue that I want her to try and bend the bar as she's going down. That might just help keep the shoulders in a little bit better alignment there. We saw the bands around the knees in the squatting example. This might be a great opportunity to do that as well. Another way to enforce that hip movement and really engaging the hips, just having the bands around the knees. If you see that they're still struggling and really don't understand that posterior weight shift and driving the hips back, you can take like a 2x4 or plates or something to elevate the toes a little bit. That actually helps them push back. So you might see somebody deadlifting with their toes elevated. That is a nice exercise to help reinforce that proper hip hinge. Okay, lunges are obviously a very challenging exercise. We're starting to progress to single leg here, which is always important. We want to make sure they have good strength on both legs. We are going to assist, and a lot of times when people are really struggling with lunges, it's probably too much. We're progressing them too fast. But if we find a way to offset that load a little bit, like I said, in the pool with bands, TRX, and all of a sudden they can do a lunge and the pain went away, or it's just easier for them, we can see that they can lunge. We didn't have to throw away that exercise. They just weren't strong enough to do their own body weight yet. So that's exactly what we're just trying to do here. We're just trying to complete the pattern. I know I'm repeating myself a lot, but that's all this phase is just designed to introduce these movement patterns in the simplest way possible so they can be successful with it, right? So make it easy, as easy as possible, and then we're going to slowly let go of the support so they are getting more and more weight that they're doing before, you know, just they get their whole body weight, and then we'll eventually add external load to there. But that's all we're doing with our lunge here. It might start with just a step if they can't do the full lunge, and that's okay too. Okay, next we'll look at our stepping pattern, right? So climbing upstairs and up and down stairs. So step ups, and again, how can we assist this? So we can use suspension trainers like we've been doing in some of the previous examples. Dowel rods for all of these work great. So just to show some variations here, but just remember what we're trying to do, assist the pattern and get them more and more comfortable. Obviously we can change the height too. So if we need this lower or higher, really what I'm going to look at, how high should it be? The starting point, the highest that I would absolutely give them is I'm going to have them stand on one leg and lift their leg up as high as they can while maintaining really good posture. However high they can get that foot, that's the absolute highest that I would put them on a step, because I know anything higher than that, they're going to have to lose position in order to get there. You're going to see them posteriorly pelvic tilt or round their back or push their head forward or something else in order to get that foot up higher. So we want to make sure we don't set them up for a bad position. So that's typically how I'll select the height and then go down, you know, from there. Or you just start nice and low and work your way up, and then make sure they can maintain posture every time you add additional height to it. So with this one, I really want them working on stepping up, not jumping up. So you can see how in our example here, she kind of shifts her weight to that front leg and pushes up. I like the cue, like I want you to break my step. You're going to push down so hard that it's just going to elevate your body. What a lot of people like to do is they like to use that back foot and they just jump up. So they're pushing off their back foot to get up versus stepping up. And then we want to look at the other piece. How are they getting down? I want to make sure they're not falling down there. They're in control, right? They're going to fight gravity and just allow themselves to lower versus just letting gravity win. And again, using that stick as much as needed. In this example, we just have one dowel, but I could absolutely have one on the other hand as well, and then progress to just one dowel. So there's lots of options there. But the main thing with our stepping up, whatever type of step up we're doing, is understanding it is a step up, not a jump up, making sure we use that front leg. And then obviously we can progress to different planes of motion, stepping sideways, adding rotations. There's lots of fun variations we can do, but in this phase we really just want to make sure they get that pattern down before we do too much variation. Okay, lateral stepping, lunges. So again, now we're starting to get into different planes of motion, so getting in that frontal plane. Whenever I look at lunges, I always consider it a step first. So don't worry about the depth, just have them get used to shifting their weight back and forth. So stepping backwards, stepping forward, stepping sideways, that's always a great place to start. And then we can get into our depth and trying to actually get lower to the ground there. So here, I'm just going to have her step to the side and then come back up. And I might do it just no depth at all and just have her step out. And then as she gets more and more comfortable, now we start to work on getting more and more depth in that lunge. Some big things I want you to focus on. They maintain good alignment through that center of gravity, everything staying nice and tall. And the feet are staying parallel. So I want to make sure she doesn't open up. A lot of people are going to turn that right foot out when they do their step up, and that's going to put a lot more pressure on the knee, and they're going to start to compensate and use muscles that we don't want them using right now. So make sure that foot stays forward. They sit their hip back. You can't see it from this angle, but that tibia should be relatively vertical on the right leg. And again, they're going to use that help as much as they need to. I'm going to be extra picky because I'm giving you help, and I want to make sure you really have that pattern down. Okay, here we're progressing. Now we're getting pretty close to our phase 3 training here, because we are going to be unassisted. You can assist this. It's just getting a little bit harder because we're going to be stepping in different planes of motion. But our lunge or step matrix, and it's kind of an introduction to unassisted exercise. I would definitely start with more of a stepping pattern. almost like a dynamic balance drill before we get into any type of lunges. But you can kind of progress to whatever the level the client's at. So we're just going to get all 3 planes of motion alternating. So we're going to be doing a forward step, a lateral step, and then our transverse step where we open up. Right, we're just trying to get some good movement in those hips and all 3 planes of motion. Not much depth. They're gonna stay pretty shallow with each one, and that's our stepping matrix. And then obviously we can add the lunge as they get better. But just getting them to move in different planes of motion is important because we need to challenge those joints, the knee, the hips, the ankles, everything. We need to really challenge it in all 3 planes of motion. We have to be careful we don't get just stuck in that sagittal plane. Great to start in the sagittal plane because it's probably what they're most comfortable with, but when we can, we need to start integrating some of these other planes of motion into their training. Okay, here we're progressing into some more balance challenges, so we're just adding some higher level drills. I love the weighted march. It's basically just a march. We saw some marches in the previous one, adding a little bit of a challenge with the band pulling them. Here, I'm going to just have them hold something. So kettlebells work great, sandbags, just something they can hold about chest height. By doing that, it's going to, again, load the spine slightly and give us a little bit of compressive force. It actually enhances some of those spine stabilizers when we're holding something. Some people will say that they actually feel more balanced when they're holding onto something like this versus just trying to balance on their own because it gives them a sense of stability. So it's kind of the next step from holding on to something stationary like a TRX or a pole or a wall or something like that, because now the weight can move, obviously, right? So they're just holding that right at their chest, and then we just have them slowly march back and forth, and we want to get them to shift their weight. She went a little bit fast in the beginning, so I cued her to slow down slightly. I want to see her shift and hold, shift and hold. We could even go a little bit slower than what you see here. So they can start with a quicker march if that's what they feel comfortable with. But the idea is I want to see a nice slow march, really understanding how to keep that nice tall posture, holding that weight. And that weight's significant. It should be something that they know it's there. We don't want them to hold like a 1 pound weight, something that they feel that they really have to focus on holding. And then we add that march. When they do the march, I would emphasize keeping the feet close together. The wider the feet, the bigger they have to shift their weight side to side. So keep the feet close so it's more just about lifting with a slight shift. And then as they progress, you can go a little bit wider, but that just makes it a little bit easier to get started when those feet are a little bit closer together. Okay, fall to single leg balance. So we're working on fall prevention. So some of these drills will be a little bit scary for some individuals. Give them support whenever we need it. We might have them do this next to a wall or towards a wall, so they always have something they can kind of grab onto if needed. But we're going to make them stand on one leg, or excuse me, they're essentially going to fall forward and then stand on one leg. And they're going to fall basically as long as they can, and then at the last minute, they're going to stick their foot out and kind of stick that landing either on one leg or in like a staggered stance. So we're going to get up on the toes, shift the weight, and then step forward and stick the landing. So it's almost like a gymnast. So we get up on the toes, they learn how to fall forward slightly, and then it's important that we work on both legs. They're going to like one leg over the other to help catch themselves, but that leg might not be available if they were to trip. So we want to make sure they can do this with both legs. A lot of good things here. Great dynamic balance drill. Great deceleration drill where they have to use the muscles of the front of the thigh to slow themselves down. That's going to help strengthen those muscles. It's going to help strengthen the joints and ultimately help them become fall proof. So great exercise here. And then we can do this in different planes of motion. They can fall sideways as well, and then they have to step sideways. So there's lots of different ways we can implement this drill, but the idea is, just start to fall as far as they can and then quickly step out. In the beginning, they're going to be a little nervous and you're going to see them kind of stick their hips back because they don't want to fall forward. That's okay. They'll get more and more comfortable with it. Just start with small steps and then they're going to get bigger and bigger steps as they feel more comfortable there. We're progressing to some higher level core challenges as well. So this is a similar drill to we saw earlier with that lateral stepping. But instead of the band being around the hips or the chest, we're going to have the bands in their hands out in front of them. So the further the band is from them, the more of a core stability challenge it's going to be. So they're going to continue to do that side step, but now they're going to hold the bands out straight. The goal is to keep those hands directly out in front of them. As they step out and the band gets tighter, it's going to start to pull them back in. So we want to make sure that they can control that rotational force. So kind of a cool exercise. We have movement that's occurring in the frontal plane as they go side to side, but the resistance is in the transverse plane, right? So we have the muscles controlling that side to side movement of the hips, as well as the muscles controlling that rotational force of the core. So a lot going on here with this exercise. Let me play that real quick. There we go. So just stepping out, and you can see as she steps out, that band pulls in. So she starts to correct it, and she's really working on holding those arms out straight and really fighting that rotational force as she steps side to side. If it gets too challenging, obviously we can step closer to the wall, keep the hands closer to you, or use a lighter band. So if they just can't keep the hands out in front, there's options that we can help them out there with that. All right, well, let's get into our final phase of training, phase 3. So 4 to 6 weeks and really and beyond. From here, we're going to start to work on some functional strength training. We might include some isometrics and eccentrics, as well as just general strength and conditioning. But really just building on the foundation that we laid. We got them moving a little bit better and understanding the movement patterns. We slowly started to remove the assistance that we were giving them, and now we're going to start to load them. And for some, that's body weight. Others, that might be additional weight. And in some cases, adding isometrics and eccentrics are great for really emphasizing that strength, especially when we're looking at the lower body. So I think those are, two common things we see, but aren't often utilized, especially with this population, to really strengthen not just the muscles, but the joints with isometrics and eccentrics. So we'll go through a few examples there. And now we're going to add some higher level training, including some power, reactive training, getting them to stimulate some of those fast twitch muscle fibers and getting them to move a little bit quicker. So we know that we can stimulate the fast twitch muscle fibers by either lifting heavy or moving quicker, or both. So we need to kind of make sure we're emphasizing something there. If we don't feel confident in loading them up and lifting heavier weights, maybe we can do some power reactive training, and we'll go through a few examples with that as well. So really, when we look at when we say power, sometimes we think powerlifting and Olympic lifts and things like that. But just remember, we're asking them to move a little bit quicker. So there are a ton of things like agility and reactive drills that are great here. So we'll do a few of these, but just know there are so many different drills we can get them to do that just have them move a little bit faster than they normally would. And that's really the key. Get them to move faster than they normally would move otherwise. That's how we get them to train these muscles, to strengthen that nervous system and the neuromuscular system. So here's a super easy example to get started. We're going to do a quick hoop step. We don't even need a hoop. It could be a line on the floor. It really doesn't need to be anything. We can use a mini band like we see here, just a little bit of light resistance to challenge them a little bit more, or we just get them to step as fast as possible. So it's literally as simple as that. We're going to step in and out. We're going to do the hokey pokey, put that left foot in, take it out, just in, out, and I'm going to have them do this for short duration. So I might say 5 to 10 seconds, and I want you to do as many steps as possible. And you can see we have a lot going on here. This is actually a balance drill, right? Because how do you step as fast as possible? You need to be able to load that right foot. If I can shift my center of gravity over that right foot and become nice and stable, now I can move that other foot a lot quicker and then use that band to add a little bit of resistance to it. So great way we can incorporate some speed or power type movement into their routine. Here we're going to use hoops again. So we're just going to do a shuffle, and we're going to add balance. I think that's an important thing. Whenever we're going to move fast, I need to make sure that you know how to slow down. And in the beginning, I'm going to emphasize that slowing down. So I'm going to make you pause and balance basically every rep to show me that you're under control. And then I'll eventually get rid of that and just have you move as fast as you can. But first, you have to prove that you can control it. So here we're going to step over the first hoop into the other one, and you're going to stick the landing. So we step quick, balance, step quick, balance. So it's just a little side-to-side step. Again, the hoops are just nice because it'll tend to make them step a little bit bigger than they normally would, but they're not necessary. But if you have hoops or ladders or tape on the floor, that all works great. And I'm just going to have them going side to side. First, with all these drills, get the pattern down first, then we go for speed. So they learn how to do the step, they add the little balance at the end, and then I'll eventually say, I want you to go side to side as fast as you can. Okay, here we have the same exact drill, but I'm adding resistance. So you can see it's really challenging her, especially to get back. So we're still trying to get her to move as fast as she can, but because we have that pulling back, it's emphasizing the deceleration, right? So she's going to pull out, and then she has to move her feet as quickly as possible, so that band doesn't just knock her over. So it's emphasizing the eccentric movement here to get her to move a little bit quicker than she would on her own, just like we see with assisted running and sprinting drills. Here we're just going to be stepping, but it just makes her move a little bit faster than normal, and that's the goal. Have them move a little bit faster, and obviously we'd spin around and get the other side as well. And obviously make sure we're mastering the movement and we're doing the previous drill, and they get really good at that before we do any type of resistance there. All right, I mentioned eccentrics. So, pick any, we're talking mainly lower body here, but obviously you can do upper body as well. But pick your favorite lower body drills and emphasize the eccentric components. So we can just have them slow down. I think it's a really simple tool that we can use to really help get them stronger and more durable by mastering these movements. So here we have an eccentric split squat. I'll usually say I want you to take about 5 seconds in the eccentric, knowing that I'll probably get about 3. I want at least a 3-second eccentric. The concentric, it can be fast. I could say I want you to stand up as fast as possible, but typically I'll say it's just going to be a normal, 3 seconds. Well, I'll say 5 seconds down, about 1 second up, and hopefully it looks something like this. So nice and slow, full range of motion, whatever that means for them, and then we just stand up. So the concentric does not have to be slow. If they do it slow, that's okay as they're learning the movement, but we're really going to stress that eccentric and then have them stand up and just control that movement to the best of their ability. But this is just one example. I just really love including those eccentrics in their program. I think they'll get a lot out of it here. Okay, here I think, as much as I love eccentrics, I love isometrics as well. So adding pauses at different parts of the range of motion of an exercise. So often we'll see it at the bottom, that it is a challenge. Not everybody's going to like to be at the bottom of a squat or a split squat or a lunge or whatever it might be, but we want them to get a little bit more comfortable. That tends to be where they're weakest, so adding those little pauses helps get them much stronger in these different exercises. But we can also do it at halfway or a quarter of the way down. There's lots of ways to implement isometrics here. So in this example, we're going to be doing a heel elevated squat. So we do have a little assisted advice. So we're kind of taking that over from the last phase. And maybe we feel like it's still just the best opportunity to help them squat is giving them a little bit of heel lift because maybe they lean too far forward and it helps them stay a little bit more upright on their squat. So we're going to continue with that heel lift. And now we're just going to add a little hold at the bottom for 3 to 5 seconds. We have the box set up with the pad behind her. Now that's just kind of in case. She's actually not going to sit on that. That's just there in case she needs it. If she has to take a break, if she has a hard time getting back up, she can always just sit down, rest, and then come back up. So we're just providing a little bit of a safety net for her there. So the idea is we're going to squat down just a normal pace now. We're going to hold it 3 to 5 seconds, and then we're going to stand up. So we squat down. You can see she's going to hover right above it. 3 to 5 second count, and then we're going to stand right back up. And then we squat, we hold, and then we return to the start. So just a great way to implement our isometrics. So again, pick any drill that you like to do and use these eccentrics, use the isometrics. Not necessarily every single workout. Sometimes they're going to get pretty sore from doing these different drills. I would probably start with about once a week. Pick one exercise and just see how they respond. If they are really sore because you did an eccentric split squat, we're not going to do that again for at least a week. So just keep that in mind. We don't want them to not be able to move. Soreness is definitely to be expected, but we need to keep in mind they need to be able to do other things throughout the day, and we can't have them, limping around because they did these crazy leg exercises. I threw in a couple examples here as we start to load certain exercises, and we see it in the last one. We may always have these different variations where we assist them because we feel that they can do the exercise better. So if I'm going to load them up, or maybe I'm just getting them used to body weight, there's a few things to consider and understand that these assisted devices are always going to be helpful, and if we need to use them, we should use them. So in the last example, if I feel like my client just squats better when she uses a heel lift, that's how we're going to squat. If I can get her off the heel lift, great, but many times that's just putting them in the best opportunity to either load the movement or do multiple reps or multiple sets. So I want to keep them safe, which is most important. So just keep that in mind. Here are just some more examples. We know with squats, if we need some variations to, we want them doing more reps or loading them or working on depth, whatever it might be, the more the shin goes vertical, the more forces are placed on the knees. The shins do go, the more the shin leaves vertical, so the more the knee pushes forward towards the toes or past the toes, the more force or stress will go through the knee. Now this is totally normal and it's going to happen in a squat. But remember, this is a special population that we're talking about, and we might want to modify so we're not putting as much force through the knee. So we might look for exercises where we can keep the shins a little bit more vertical. That's why a lot of people have an easier time deadlifting than squatting, because we don't have as much forward knee movement here. We can keep the shins much more vertical. Here are just a couple examples of how we can modify the squat. So if we are going to be loading it up or using their body weight, we have a few examples of keeping the shins vertical. So one you probably have seen a million times, but the ball squat. But just keep in mind where the feet are is going to influence where the knees go. So if the feet are out in front of us a little bit further, it helps us keep more of that vertical knee position. So we don't want them so far over that the knees are going backwards when they squat down. So it should at least be level, so we see that nice vertical position as they stand up. And then as we start to move the feet back closer to the wall, it's going to push those knees more and more forward, like we would see in a traditional squat. So this just might be a way that we modify it to help the client out so they can do squats and it's pain-free. Because remember, we're trying to keep them as pain-free as possible, but moving as much as possible. And sometimes we need to have some modifications there. This is called a Spanish squat. So we're using a thick band that's going to assist them. So they're going to drive their knees out like we might see with the mini band. But since it's pulling them so far forward, it actually allows them to really sit back. So you can see there's a little bit of a forward movement with the knee, but much less than if we were doing a traditional squat here. So sometimes it's not as comfortable on the knees, and you might have to put a towel around there or foam padding. But this is an option too. We have the Spanish squat. It just helps them keep that vertical knee position and still allows them to squat pain-free, hopefully. Okay, with the deadlift, now if we're going to start to load it, we need to keep a few things in mind. I do bring this up particularly with the hip replacement in mind. We might have limitations on how much hip flexion they can do, and they may not be able to get all the way to the ground. So traditional deadlifting might be a challenge for them. So we might do a sumo deadlift where the feet are a little bit wider. It's going to make them get down a little bit lower without as much hip flexion. And keep in mind, we can always just elevate the weight. So we're just kind of taking it to their abilities, right? So I'd love it if you could deadlift from the floor, but maybe it's just a little bit too high risk. And I don't know right now if you can get that much range of motion, but I'd still like to get you stronger, and I'd still like to work on that hip hinge pattern. So this might be a good alternative. So the big key here is just keep in mind, reducing range of motion is always okay, right? I'm going to stick to the range of motion you can successfully do. And then as you get better and better, we're going to try and add more in, but we don't need to be in a rush. I don't need to get to the finish line before I get to the start line. I need to master the easiest regression first, and then we start to layer in harder and harder progressions. So just keep that in mind, whether it's a deadlift, a lunge, a squat. We stick to the range of motion we know they can perform well. we potentially load that up with their body weight or extra weight, and then we get them better and better, and hopefully add in more range of motion when it's appropriate. And then don't forget, let's get in other planes of motion. So here we're doing our lateral step with a drag. So we're getting in the frontal plane. We have a slider here. You'll even see sometimes people use plates because it creates a little bit more friction. This can be a lunge. This can be a step. We're just going to have them take a step and then drag that weight over, right? So we're just getting in that frontal plane. Should basically looks like a lateral lunge. And then we just slide the feet together. I do like to cue that back leg should be totally straight. Whether you're lunging or stepping, we're not pushing off that back leg. We're trying to teach them to load that front leg. So they're going to step, shift all of their weight onto that right leg, and then just stand up and pull their feet together. So it's really getting them to rely on that one leg to do the heavy lifting while the other leg is just dragging, almost like they had a limp and they just had to drag that leg along. So just keep in mind that front leg is doing most of the work. They'll feel that inner thigh on the back leg, but really the front leg is the one carrying the load here. All right, ladder drills always come in handy, especially as we're talking about power and reactive drills. These are just really simple things we can do to get them moving quicker, getting the hips moving in different planes of motion. And I like these because it's a little bit of impact, right? The more they run through and the faster they go, there is some impact, which is great. It's going to help build up those joints and connective tissues. And then it's going to get them, just moving the joints in all three planes of motion. So just have a few examples here. We're going to progress through. We're going to go sagittal. We're going to go frontal plane. We're going to add some multi-directional, and we're going to add some transverse. So we kind of get a little bit of everything here with these different examples. So here, pretty straightforward. We're just going to run through. A little bit of impact, picking your feet up, working on going through a little bit faster than you tend to want to, right? So just incorporating that power training there. All right, and then we're gonna do the same exact thing, but now we're just gonna get in that frontal plane with our side stepping. So again, when we change planes of motion, we are changing the types of muscles and how the muscles need to stabilize and move joints. So it's really important, as simple as these drills are, just making sure every session I get you in different planes of motion, because I'm gonna challenge those different stabilizers in different planes of motion to get them more and more developed and stronger to handle, the forces that they're going to see in everyday life. So we got sagittal, we got frontal. Here we're going in the transverse plane, right? So we're just adding that little bit of rotation, that crossover step. This is a hard one for many people. They really don't like that step over position. But in terms of fall prevention, one of the most important steps you can learn right here, because oftentimes that's what you need to do to help yourself from not falling, is that step over, crossing over that midline. So great exercise here. And then here we're just adding multi-plane. So I'm really making her think, and you can see she struggles a little bit to get this pattern down. So we're just going forward and out to the side. So the left foot's always going forward, the right foot's going in and out. So I have a sagittal plane and a frontal plane movement all happening at the same time. So not only getting their brain to work, but getting those joints to move in different positions. And then obviously we go back and get the other side there as well. All right, mat runs and marches. If you have access to something like this, a big thick pad, we can kind of add some of these impact exercises, but we're on a very soft surface, so we don't have as much force going through the joint. So this is just a big speed pad, essentially a big piece of foam. Great balance challenge, because it's kind of like being in sand. It's moving as they go, so it's a fun challenge. So we're just going to march in place. So we have balance here. Have to work on that control. We can work on stepping down, pushing into that pad nice and hard, and then eventually I can actually go into a run if they feel comfortable with this. And it's very soft, very easy on the joints. Nice little conditioning drill there, but it really just gets them moving faster and really working on that control there. So a nice option if you have access to something like this, but any kind of padding works where it's just a little bit softer, so it's not quite as hard on their joints, and they can create that quick movement there. All right, adding more and more, as they're getting more advanced, we're trying to challenge them more and just getting them to move a little bit better. Here We hear of stepping lunges or walking lunges all the time, but you don't hear of stepping deadlifts or walking deadlifts very often. And that's all we're doing here. Is it's going to look like, and really how I teach this is I want you to take a baby step forward, reach down like you're picking something up, stand up, and then take another baby step forward with the other leg. So it is a small step. That's probably the hardest part with this one. They want to take a big step like they're doing lunges. But we have them in this staggered stance, which is great. They might be able to get a little bit lower in this position than they would if they were doing kind of a traditional deadlift. So we just take a step, shift our weight forward. So you can see a little bit of balance here. She fixes it, gets right back to it. We bow, stand up tall, bow, stand up tall, right? So moving in that sagittal plane, we have a little bit of resistance there. Great exercise though, controlling that dynamic balance, changing the foot position, just a lot of different things going on here. So really fun exercise once they get the hang of it. All right, and then, don't forget about the balance. We've really been working in balance in a lot of these different exercises, but we're going to just add more and more higher level balance challenges. And I think like different arm drivers, whether it's with or without weight, are great ways to dynamically challenge balance. So it might start simple with just standing on one leg and using the arms as drivers to essentially try and knock themselves over. So they're just going to chop their arms. We have this diagonal pattern reaching across the body, and she's trying to maintain that single leg stance. So you can see in the beginning, she has her foot pressed against her calf in that stork stance, because this might be the most appropriate balance position that we want her to do this in. She might be able to just keep it off the ground like we see here, or maybe that's too much of a challenge. And don't forget that single leg support stance. We can do our balance challenges that way as well. Then I might add a little bit of load, right? So we just have a 2-pound medicine ball here, but it's still enough to shift her weight back and forth and really challenge her. So obviously we're doing both legs here, but she's just working on that balance while she's moving that weight side to side, which just challenges her a little bit more. Here we can use a band or a cable machine, and we're doing a single leg chop. So we're just trying to maintain that single leg stance. We have very light resistance on here, and we're just chopping across. So we're getting her really, really strong on that single leg. And then here, kind of the idea with that med ball, we're going to have her stand on one leg, and she's just going to pass the kettlebell side to side. So she's staying in a single leg stance, but she's just moving that weight back and forth and making sure that she can control it and maintain her center of gravity. You can see she struggles, and hey, when they struggle like this is exactly what we want, as long as they can be successful. We don't want it so easy that it's no problem at all. We want them to have to work in order to do it. So if they keep falling over, it's a little bit too much stimulus, but if they are having a conversation and they don't really even have to pay attention, then we might want to find something a little bit tougher. But I think a lot of these types of drills where we're trying to pass a weight or move an object around while we're balancing are plenty difficult for most clients. Okay, so some big takeaways. Hopefully those 3 kind of phases that we went through all make sense. And I think if you stick to the guidelines there, obviously we only covered a couple exercises in each one. You know a lot of exercises, just find where they fit and have a good system to progress and get them into the right level based on what they can do. So some of the things to recap that we talked about, and actually I can't remember, we might not even talk about this point, but I do want to bring it up. So using the non-surgical leg as a baseline to monitor asymmetry. So we did talk about asymmetries, but being able to use the side that did not go through surgery as kind of the baseline, right? We're always trying to get as close to that as possible, whether it's girth measurements like we talked about, or strength or mobility or whatever it is. So we don't want to see these major asymmetries. We want to get them closer and closer with these different drills. But at least we start with our baseline, whatever that is. Use that non-surgical side, but we went over a whole bunch of other assessments and screens that you could do. We want to look at range of motion, especially the ankles, the hips, the knees. Are they moving to an appropriate level? They don't have to be able to do splits, but they need to be able to move that joint successfully. We want to make sure we improve that lower body and core strength and stability, and then eventually progress to higher level challenges when they're ready, making sure that we follow those different systems, those phases that we were talking about. And then monitor functional performance, track progress, right? Make sure, are we getting better? We set that baseline. Are we getting better with each phase that we go through? And then the big thing, like I keep talking about, don't ignore everything else, right? This is not the entire program. This is one piece. We're going to get them stronger, upper, lower, total body movements. We're going to get that conditioning, aerobic capacity. We're going to work on everything. Don't just dwell on the parts that aren't working as good, right? We're going to get them better, but focus on the things that they can do and they can work hard. That's where we're going to spend a lot of our time, and then we're going to assist them with all the other pieces that they need help with. All right, so we made it through the webinar. Thanks for sticking around. Again, just real quick, how to get your CCs. You're going to log into the website at exerciseetc. Click on the administration tab on the right side of the screen. Click on Webinar On-Demand Certificates. Remember this specific title: Progressive Synchronization, Training Before and After Hip or Knee Replacement. We want that exact title because you will have to take that 20-question quiz. Then you'll fill out that brief evaluation and be able to get your certificate emailed to you instantly. And just a reminder, make sure you have that handout with you. That's the order the quiz questions are going to go through, so it's going to make your life a lot easier if you follow along based on there. And then remember to complete this webinar and print the certificate by December 31st of the year you ordered it. We want to make sure that you get credit, and we want to make sure it has the correct date on it. So take care of that in the same year in which you ordered it. Again, my name is Mike Diebler. Thank you so much for sticking around, and I hope you learned a lot of great information that you can apply right away with your clients. And I hope to see you again on a future webinar or one of our live courses. Until then, we'll see you later.